This segment of Delmarva Life is brought to you by TidalHealth.
In 1974, former First Lady Betty Ford revealed she had breast cancer. A pretty shocking announcement because no one talked about the disease in the 70s. In fact, Ford is credited with bringing the #1 cancer among women out of the shadows and into casual conversation. Well, today we devote the whole month of October to breast cancer awareness. And here on Delmarva, more people have access to advanced and comprehensive breast cancer programs thanks to TidalHealth. And joining me today is Dr. Karen Barbosa. She is the medical director with the TidalHealth Delaware Breast Cancer Program. Doctor, thank you so much for joining us this afternoon.
Thank you so much for having me. It's a pleasure to be here, despite the weather.
Yes, yes, but it's awful beautiful weather at that. So, you know, one of the things that when I was doing the research on Betty Ford, one of the things that they brought up was the fact that a lot of people didn't want to admit that they had breast cancer surgery, which is what you do. Can you tell me the medical conditions you treat?
So I treat everything from just questions. People have multiple questions on, breast pain or family history. Sometimes there's a question about nipple discharge. Sometimes people have questions about their imaging and they're not really sure of what the results mean. So anything that is concerning to a patient is what I treat. And it's not just about surgery. So it's important for women to know that there are now ways of looking at if they're high risk and then following them for high risk. And it's not just about operating and removing the breasts.
Now, it's awesome that we have these services that you offer here on Delmarva. And now you're offering breast services in Seaford and Millsboro. How important is that to have those services in Sussex County?
So I think it's important nationwide. I think the important thing for people out here in the Sussex County area to realize is that the ASBS, or American Society of Breast Surgeons, is making a really strong push nationally to train all surgeons to do oncoplasty, which is the fusion of plastic surgery and cancer surgery. So basically, you're preparing the surgical incision as an orientation to optimize the cosmetic result afterward. No woman wants to look in the mirror after having surgery and then find that they're disformed or disfigured. And so it's really about training doctors all over the US to have these skill sets to minimize, the trauma to the patient on the cosmetic level.
Wow, and I imagine that makes a huge difference. Now, talk to me a little bit about your vision for the program beyond that.
So I think when I came out to the shore, it was something to me that I wanted to bring everything I'd learned and been part of when I was at my ASBS meetings. And a lot of it is looking at de-escalation. So the current themes of breast surgery and breast cancer treatment is about de-escalating treatment. And really, we talked a lot in the past about tailoring a treatment specific to a patient's needs. Basically, no more cookie cutter or algorithms, if this, then this. Really looking at the individual and making sure that the treatment is really tailored. So very patient-specific treatment options. And that's looking at not only the surgical end, but looking at what happens before you even go to surgery. And I'm excited to talk about genetic testing, genomic profiles. So understanding the difference between the two. Genetic testing is looking at a person's DNA, things like BRCA mutation, which can put a patient at risk for having breast cancer, versus looking at the cancer's DNA and finding out if there's a benefit for chemotherapy or no benefit or little benefit. And then looking at, DCIS, which is an in situ, and then deciding whether that tumor has a benefit for radiation or not. And basically giving patients the empowerment of making an educated decision. Whereas before we just used to say, well, if you've got this, then you should get that. It's really now about having educated discussions based on the information we're gathering from the patient's DNA and from the tumor's DNA. And that's a really exciting time in medical management for breast.
And obviously this brings great things to the patient.
Oh, yeah. I think it's really helpful when patients get the diagnosis. It's very scary. It's frightening. But when we can do these tests and say you don't have a predisposition, the benefit of bilateral mastectomies in someone who doesn't have a mutation is much, much less. I mean, the benefit of a mastectomy in a patient with a BRCA1 or 2 mutation can be a risk reduction of anywhere from 98% to 95% reduction. And that's a huge reduction. When you don't have a BRCA mutation and you do bilateral mastectomies, there's still a chance of about 10% that you're going to have a recurrence. And people don't know that. Their understanding is no breasts, no possibility of breast cancer coming back. And that's not true. But
Sure.
I think a lot of times patients are scared and concerned, and sometimes the messages aren't getting across. And so I feel like educating the community before there's a problem is a really important thing to do. And then when you have a problem, reminding patients to, breathe in, breathe out, and get more information before making life-changing decisions.
Well, we are so fortunate to have this program here on Delmarva. Dr. Karen Barbosa with TidalHealth, thank you so much, and have a great day.
Thank you. Take care.